What should be my tip? On this episode of Coding with Kate, we're going to do kind of a mix between a Q&A and a tip, technique, and example. And the Q&A comes from 2 questions that I received just recently, and I think they represent a good tip, technique, and example. So, let's start out with... which one? Alright, this was a fun one. I got really excited when I read this question because I like digging for the answer since I didn't immediately know what the answer was. And this one was just commented on or posted yesterday. So they wanted me to explain what extracorporeal meant, why a cardiopulmonary bypass is extracorporeal, and then what is the difference between single and continuous, what is output, and what is pacing. So thankfully, I don't think I needed too much context for the second, third, and fourth questions. Just by what the first question was talking about, extracorporeal and the bypass thing, I kind of had an idea of what they were talking about. I'm awaiting a specific context just in case I wasn't in the right area, but anyway, so now from those questions we can work through a tip, technique, and example. So I'm going to start with my tip. So my tip for this would be, and this also relates to the second question, which we'll get to in the example portion, but so my tip would be to use Google to help refine what it is you're looking for. The technique on how we do that, or how I usually do that, is Googling the terms that I'm not sure what they mean, and then also with some of these med terms, breaking down their prefix, suffix, root words, etc. to figure out what their meaning is to help bring me in that right direction. But the example is more important because I can go more in depth on explaining some of this stuff. So, extracorporeal. I honestly didn't remember what it meant because in a lot of my coding things for practicing, they don't really talk about it. So I had to Google extracorporeal. While I was editing, I realized I didn't explain extracorporeal that well or even correctly. So extracorporeal essentially means from outside of the body. Extra meaning outside, corporeal meaning the body. So when extracorporeal is used to describe therapy techniques, medical treatments, that sort of thing, they're talking about something that happens outside of the body or externally. Now I'm going to be explaining the cardiopulmonary bypass, but I just want to preface that saying that cardiopulmonary bypass is considered extracorporeal because the heart and lung machine is outside of the body and the pumping of the heart and the perfusion of the blood via the lungs is happening outside of the body with the use of the heart and lung machine. Basically, a cardiopulmonary bypass is basically using the easy term, heart and lung machine. So when they're doing heart surgeries, anything where they have to do work on the heart, they have to essentially stop the heart from beating so then they have a still static body part to work on. Because if you have this beating, it's going to be very hard to do a lot of the intricate work that has to be done, and you could puncture your heart, and that would be a bad thing. So they have to stop the heart from beating, and they use the heart and lung machine to do that. So they essentially arrest the heart, stop it from beating, and at this point the heart and lung machine is essentially connected to the human, so the blood is passing through the heart and lung machine, that blood is being oxygenated, and then it's pumped directly into the body to all the other body tissues with that oxygenated blood, where the body can still function, but you're not using the heart to do that work. You're using the machine to do that work. Now, as far as the single and continuous, so again, I had to Google cardiopulmonary and then single and continuous to help define what it is we were talking about. And then I was also looking for pacing, and that I kind of, found a connection between the two. So let's start out with the pacing first. So pacing essentially is not a technique, but it refers to patients that have a pacemaker. And at my hospital, I get documents that are called Pace Watch, or the clinic or area of the hospital that does that is called Pace Watch. And essentially, it's patients that have pacemakers or just recently had pacemakers implanted. And this whole pacing, Pace Watch, etc. is basically a stress test, essentially, to calibrate the pacemaker, or to make sure the pacemaker is working properly so that it is beating correctly when there is stress on the heart, or just at a regular resting heart rate to make sure it's functioning properly. As far as how I explain pacing, I was kind of in the right direction, but as I was doing a little bit more research after I had edited, etc., I realized the way I explained pacing wasn't quite right. So doing some Googling helped me figure out that pacing is more or less used to set the pace of the pacemaker. So setting the heart rhythm that the pacemaker will be initiating or maintaining, etc. As far as the single and continuous, I kind of think they're talking about how it relates to the pacemaker specifically. Now, I assume single refers to a pacemaker that is only used for a patient who has a normal heartbeat, but every now and again there's an arrhythmia or an irregular heartbeat, or the heart just stops beating and the pacemaker needs to shock that heart back into its regular sinus rhythm. And continuous would be patients who have a chronic arrhythmia or a chronic irregular heartbeat, or the SA node or the AV node is not working properly, so the pacemaker is a stand-in to make sure that sinus rhythm stays the same and that it's beating properly and continually, so it's constantly shocking the heart to maintain that normal rhythm. Whereas with single, it's whenever it senses the heart is not going to beat properly or isn't, it just shocks the heart once, and then the heart beats just fine for a long period of time until the next time it doesn't work. So I think that's what they mean by single and continuous. And then they also asked about output, and I believe output is just talking about the oxygen saturation of the blood, so how much oxygen is getting into the blood and then into the rest of the body tissues and other blood gases, I believe. So it was a lot of Googling and breaking down those med terms to figure out what body system we're talking about, and then specifically what specialty or niche of the cardiac system we were talking about. Now, the other example that goes more towards breaking down med terms more would be this other comment. All right, I'll try and remember the exact procedure. But they were asking about not understanding laparoscopy and lysis of peritoneal adhesions. I believe that's what it was. So this is where the technique comes in as far as breaking down med terms to figure out what it is they're talking about. And you will have to read the op reports to verify that yes, what they did is what they described in the procedure title. But when you break down med terms to figure out what they're talking about, use your medical dictionary if you need to, but I'll actually break it down for you. So laparoscopic, if we break down that word, laparo is essentially relating to the abdomen. So whenever you hear laparoscopic, laparotomy, they're talking about something with the abdomen. Now, scopic refers to the examination of the body using a camera that would go inside. So a video camera that goes inside the abdomen, a scope. Laparoscope. So it is a scope that goes into the abdomen to look within there. So we have laparoscopic. Now we have lysis. Now lysis is the destruction or removal of something. And then peritoneal adhesions. So peritoneal refers to the abdominal cavity. And then adhesions are the connective tissue that either comes from, I believe, scar tissue or just that connective tissue in between body parts and things. And usually when they're talking about adhesions, they're talking about it in the sense of it's obstructing the body part from functioning properly. So they are going into the abdomen with a scope into the abdominal cavity, the peritoneum, and they are destroying or removing connective tissue that is obstructing the digestive system from functioning properly. That's essentially what that means. And as you read through the op report, you can see if there's any differences from what the procedure title says. So they might say laparoscopic, but really it's an open procedure, and they just use the scope initially to get in there, but then they cut them open completely and then did the work in an open sense. And you might find also that instead of just the peritoneum, they were specifically working on the small intestine or the large intestine, so the adhesions in between the folds, so that connective tissue in between that folds that are causing an obstruction of that tubular body part. So as you read through the op report, you can focus in and hone in on what the procedure actually did or what it actually was. But breaking down each med term to figure out what it means will help you understand what the procedure is, or at least a general idea or the gist of, or the initial objective that they were trying to accomplish in that surgery. So hopefully that all makes sense as far as use Google if you don't understand what a word means, or a procedure, or a therapy technique or something. Use Google. Go to reputable sites, so anything that's .org, .gov, you're going to be fine with those, or scholarly articles. You'll have a better time of finding the information, and it will be more accurate information. The technique, breaking down those med terms to also help you understand what that statement, that phrase, that procedure, that diagnosis, whatever it is, understanding what it means. And also giving you a better direction on where to look on Google or online or in textbooks, whatever. And then those two examples I think are really good examples for how to search on Google and how to make connections between the information. And then also in that second example of actually breaking down the med terms to figure out what they mean. And I want to give you all these tools so then you can start to use it on your own. And then if you still can't find the answer, or you're finding conflicting answers, then yes, go to a professional or someone who works in that specialty and ask them. But you have these tools, go out and use them, because it will help you problem solve in the future, and it will give you more avenues of figuring out this information. Hopefully that was helpful. I had a lot of fun, especially with the cardiopulmonary stuff. That was really exciting to have that breakthrough, because I honestly didn't know what pacing or pace watch was. I really didn't know, and I never took the time to look for it. So I was really excited to actually go and look and make these connections and figure it out. So go and do it. It's a lot of fun. You feel very accomplished when you actually understand the information when you're done. It's pretty awesome. So, if you have not done so already, subscribe to this channel so you can get notifications on all the videos that I post, so you're always in the know Comment below if you are in the cardiac specialties and you can give more information on pacing, pace watch, pacemakers. I would love to learn that more. So comment below on that. Also, if you have any other experiences with using this type of technique, please let me know, because I'd love to hear what you all did and what information you used. That would be great. And also, like this video if you like the topic. And I'll see y'all later. Bye!